as we get older, many of us will start to think about investing in various different supplements to boost our health and to get all the nutrients that we need. But with all the information out there, it can get really confusing. So I've been joined today by Bupa's own lead dietitian, Niamh Hennessy, to put some of those myths to bed and find out actually how we can all benefit from using supplements or not. So Niamh, let's start off with dietary supplements. What do we actually mean by dietary supplements?
When we're talking of dietary supplements, we're looking at how we can supplement the diet as opposed to replace normal foods.
Okay, so does that mean then ideally people would have a super healthy, balanced diet that includes lots of various different food groups and not need a supplement, but it can be used in addition if required?
Yeah, so ideally we get all the nutrients that we need from food, looking at making sure we get lots of fruit and vegetables because they're very high in vitamins and minerals, making sure that we're having some protein sources, meat, fish, beans and lentils, and then making sure we're getting our calcium from our dairy products as well.
So I guess the question is if people are struggling with that, and I think sometimes as we get older, we can struggle with appetite, we can struggle with even, if we cook, especially if you're cooking for one, sometimes people can't be bothered to buy, a huge shop and do cooking, and we tend to rely more on convenience foods. So what nutrients might people be lacking in, and what would be the best way for them to utilise supplements?
There's definitely a place for supplements as part of a healthy, balanced diet. What we would do is have a look, and everything is tailored to the individual. So if, for example, you haven't been really good with your oily fish, taking a fish oil supplement, it can be really helpful as we get older, making sure that we have really healthy joints. Then looking at calcium is another one, because we really want to prevent brittle bones and osteoporosis as we age. So it's making sure that we get enough calcium. So if you find that you're not very good on having enough dairy in your diet, having a calcium supplement is really beneficial. But I suppose the key one here is as we get older, we're less likely to spend large amounts of time outside. And particularly in the months of September through to April, it's really important that we have a vitamin D supplement. And having a conversation with your GP or your pharmacist will get the right mix for you.
Okay, I always advocate for everybody, if they can, to be physically active and spend time outdoors. But I know realistically for some people as they get older, that becomes more difficult and they tend to spend pretty much all of their time indoors. Would you recommend that for those people vitamin D should be taken all year round?
Yeah, definitely. I would. If you're not getting out, even for an hour a day, it's more beneficial to get outside. But taking a vitamin D supplement won't do you any harm.
Okay, so that's great. So that's some of the benefits in how people can utilise supplements. Do they have the potential to be harmful though?
They can be if taken in excess, and this is where you need to be careful, and having that conversation with your GP or your pharmacist can be helpful. So if you're taking lots of different supplements, they can often, like calcium will always be, or most often will come with vitamin D already. So you want to make sure that you're not taking then very high dose of vitamin D on its own. Or sometimes if you're taking cod liver oil, there could be vitamin D in there as well. So it's just making sure, and if you're in any way in doubt, have a chat with your pharmacist and they can help to guide you.
Okay, that's great. So you've talked a little bit there about supplements that can help support joint health, like fish oils. I think supporting our immune systems can be, it's important for everybody, but I think especially as we get older, vitamin D is important for looking after our immune system, isn't it? Are there any other supplements that you would recommend that can support the immune system?
If you're finding you're getting colds and flus more regularly, I would suggest a multivitamin, because that will cover all areas. And there's no one vitamin or mineral more important than the other. We need everything in moderation. So taking a multivitamin, they tend not to be overly expensive. And if you're buying them from a reputable source, which is key here, you can be assured you're going to get enough of what you need, along with a balanced diet.
Okay, and I think sometimes having a chat with your pharmacist is a great idea, isn't it? Because the pharmacist, they know what they're talking about, they can direct you towards perhaps a supplement that is within your price range, won't break the bank, but also that is safe to take and likely to be helpful.
Yeah, you can only use 100% of your recommended nutrient intake. So there's no point taking very expensive supplements that will say they've got 500 times or they have 10 times what you need, because otherwise it's a very expensive wee that you're producing.
Yes. So maybe like a typical multivitamin and vitamin D for most people. There may be some other people who have additional needs. There are a lot of supplements out there that promise to lower cholesterol and even things we can buy in the supermarket. Is there any truth to these?
Yeah, some of them can be really, really effective. So we are talking about our stanols and our sterols, and they can have a really positive effect on your diet, but it's really important that you take the recommended dose.
Right.
And this is key here because it's only effective if you're taking the right amount. Right. And all the different brands have different quantities that you need to take for it to be effective.
Okay.
Oftentimes it's the yogurt drinks that tend to get you the dose more effectively than some of the spreads.
And if people are actually looking to try and look after their cholesterol levels through the diet, what advice would you have for them there?
So what I'd recommend here is having your fruit and your vegetables, because they'll help with your immune system as well as with your cardiac health. But you're looking at increasing what we call monounsaturated fats. So these are the types of fats in your rapeseed oil, your olive oil, and these will help lower the unhealthy cholesterol in our body while raising the good cholesterol.
If people are having a very balanced diet, eating loads of fruit and veg, some fish, some lean protein sources, as well as complex carbohydrates, whole grains, and they're having a really healthy diet, is buying supplements just a waste of money?
It depends on the individual, because sometimes the placebo effect can be beneficial to someone's health and well-being. But if they're having a healthy, balanced diet, you may not need to take any supplements. What we would recommend is try a couple of weeks without them, and if you don't feel any different, then obviously you don't need to continue with them. But if you are feeling, especially in the winter months, if you're feeling a bit cold and fluey, taking a multivitamin won't do you any harm.
It does seem like when you're in the supermarket now, and these things are available in supermarkets, there's a bar or a shake for everything. So for weight loss, meal replacement, to help you build muscle, sort of protein shakes. Are these all just a waste of money and nonsense, or actually can they be helpful for people?
It all depends on your diet and lifestyle, and for some people it may be more challenging to cook 3 meals a day. So by having a shake, it helps save them time, especially for our younger population. But as we get older as well, it can be more challenging to prepare meals. So having a shake, it's better than having nothing. Obviously, having a warm meal, a shake isn't going to replace that. But I think we need to get rid of the idea that it's bad for us or there's something shameful or wrong in it. As part of a healthy, balanced diet, all these foods can be helpful.
And we know that as we get older, sometimes people struggle to get enough protein in their diet.
Yeah.
And we're also told now that around the time of menopause, it's really important to try and keep hold of our muscle and build muscle if we can. So are protein shakes helpful for that?
They can be a real convenient way for older people especially to get the right amount of carbohydrate and protein.
Right.
And it's key that we get both in to help with muscle and building muscle, but also preventing muscle wastage as well.
Okay, so having protein shakes is okay?
It's absolutely fine.
Having multivitamins is okay?
Yes, you can take your multivitamins.
Having a vitamin D supplement is a really good idea.
Essential.
But essentially don't throw your money away spending a fortune on supplements that aren't going to benefit you as an individual.
Yeah, it's everything in moderation.
Okay, perfect advice. Thank you so much, Niamh.
Thank you.